If untreated, type 2 diabetes can cause long-term health issues, though many people shrug early symptoms off and continue with their everyday lives. Why? Symptoms do not necessarily make you ill, so they are often left untreated. Urinating every hour or so during the night is a common, irritating symptom of type 2 diabetes but not intolerable. What is occurring underneath the surface, however, is it be taken alarmingly. Type 2 diabetes is a common condition that causes the level of sugar, glucose, in the blood to become too high. It is caused by problems with hormones called insulin. It is often linked to being overweight or inactive, but it is also hereditary. Type 2 diabetes is a lifelong condition that can affect your everyday life. You may need to change your diet, take medicines and have regular checkups. If left untreated for too long, high blood sugar levels start damaging the blood vessels that supply blood to vital organs. When this happens, an array of unusual symptoms might begin to show on the surface of your body. Type 2 diabetes, if left untreated, can lead to diabetic neuropathy, nerve damage. One major sign of this is when you come into contact with different surfaces. According to Mayo Clinic, peripheral neuropathy, the most common form of diabetic neuropathy, can lead to increased sensitivity to touch. For some people, even a bedsheet's weight can be painful. High blood sugar over time can damage or destroy nerves, resulting in tingling, numbness, burning, pain or eventual loss of feeling that usually begins at the tips of the toes or fingers and gradually spreads upward, the Health Body explains. The symptoms of peripheral neuropathy are often worse at night, it adds. Where you live in England may determine your risk of dying from COVID. New study vitamin B12 deficiency, 3 symptoms that can lead to nerve damage, what to look for. Expert cutting down on calories can boost longevity, but how much should you cut back? Study, recognizing the early signs of type 2 diabetes can allow a person to get a diagnosis and treatment sooner. Getting appropriate treatment, making lifestyle changes, and controlling blood sugar levels can greatly improve a person's health and quality of life and reduce the risk of complications. Without treatment, persistently high blood sugar levels can lead to severe and sometimes life-threatening complications, including heart disease, stroke, kidney disease, eye disease or loss of vision. Untreated diabetes can also lead to hyperosmolar hyperglycemic noncotrotic syndrome, HHNS, which causes a severe and persistent increase in blood sugar levels. An illness or infection will usually trigger HHNS, which can require hospitalization. This sudden complication tends to affect older people. Keeping blood sugar levels under control is crucial for preventing some of these complications. The longer that blood sugar levels remain uncontrolled, the higher the risk of other health problems. According to the NHS, you should contact your GP immediately if you experience symptoms of type 2 diabetes. You'll need a blood test, which you may have to go to your local health center for if it cannot be done at your GP surgery, explains the Health Body. Once you receive a type 2 diabetes diagnosis, steps must be taken to stabilize your blood sugar levels. There are 2 major components to controlling blood sugar levels: eating a healthy, balanced diet and engaging in regular exercise. Foods that are high in carbohydrates are at most risk of increasing the chances of developing type 2 diabetes.